Alexia, and today I'm going to be discussing the cardiac response to acute aerobic exercise, specifically looking into the impact of cardiac output and blood pressure. We know that aerobic exercise is going to be the use of oxygen that allows the body to perform exercise lasting more than 1 to 2 minutes all the way to long distance endurance events. And this is going to be categorized into 3 groups, which is going to be at different intensities. That's going to be measured through the metabolic equivalents known as METs, where we're going to have light intensity, which is going to be less than or equal to 3 METs, while moderate intensity is going to be between 3 and 6 METs, and vigorous is going to be known as above or equal to 6 METs as a whole. Now, what makes it acute? We know that acute is going to be at a high intensity known as vigorous. Once again, it's going to be above or equal to 6 METs as a whole. And it's going to be through an exercise of one single bout, meaning it's not going to be repeating constantly with intervals of rest in between. It's going to be in one go. Examples of this is going to be swimming, cycling, and rowing. To acute aerobic exercise is going to be the body's ability to create a reaction that increases cardiac output, stroke volume, heart rate, systolic blood pressure, as well as overall blood flow to activated muscles during the exercise, as well as decreasing diastolic blood pressure as a whole. Those are going to be the components of the cardiac response to acute aerobic exercise. We know that it's going to be the amount of blood that's going to be pumped by the heart in liters per minute, while the components are going to be stroke volume, where it's going to be the quantity of blood ejected with each beat, while heart rate is going to be the number of contractions the heart makes per minute. Overall, according to a study that was an article study, we were able to see that the vigorous intensity in aerobic exercise through one single bout at a constant days of progression of trials, it showed that the left ventricular end diastolic internal dimension and systolic was going to be increased in thickness, and ultimately led to the left ventricle function at a higher capacity, which allowed the group to conduct at a higher exercise capacity because the improvement of overall cardiac output components were increased and able to flow a lot smoother.
Overall, we know that the heart rate is going to be increasing linearly as the increase in intensity happens, and we know that stroke volume is going to be increasing as well through the end diastolic volume. Overall, with the maximal exercise of acute aerobic exercise, the cardiac output will increase about 4 times the resting level.
Is going to be the force of circulating blood on the walls of the arteries, which is going to be measured through systolic and diastolic pressures, where systolic blood pressure is going to be at its highest point through the artery walls, while diastolic is going to be at its lowest point in the ventricles. According to the study that was done on borderline hypertensive men and women, the acute aerobic exercise done at a moderate level, meaning between 3 to 6 METs, caused the group to have a lower blood pressure response. We know that the systolic blood pressure will increase with acute aerobic exercise, and that diastolic blood pressure will eventually decrease because it provides an indication that the peripheral resistance that can decrease with this type of exercise is due to the overall vasodilation.